So I'm going to have Noah introduce himself.
Okay. I'll give you a cue.
Thank you. Yeah.
Yeah. Yeah.
Okay. As everyone's trickling in, I wanted to say welcome to the State Office of Rural Health webinar series. We're excited to have you here. A couple kind of things to note as we go into this. We will have the uh, we'll have participants muted, so any questions can be put in the question chat box, and those will be addressed at the end of the webinar. Additionally, this webinar is being recorded, so if you have people that you'd like to share it with or questions after the fact, please reach out to the speakers or we'll send a link to the presentation as well. And with that, I will hand it over to our presenters.
Awesome. I'm Noah. I'm a third year medical student at the University of Arizona College of Medicine in Phoenix. I grew up in Northern California. I moved down to Southern California in Los Angeles. I went to undergraduate at USC. I majored in human biology there and stayed around Los Angeles for a couple of years after that, where I was involved with a mutual aid group called Water Drop LA, and that kind of gave me my little introduction to harm reduction, which made me really passionate about it and wanted to continue doing that work when I moved to Phoenix, about a year and a half later or so. So when I got to Phoenix, I kind of tried to find my niche in that whole world, and I kind of got introduced to our interest groups here on campus. I was involved with the Street Medicine Phoenix organization, which we're going to be talking about right now. And I was the overdose team lead with them for about a year. In addition to that, I'm working with our College of Public Health to kind of implement different harm reduction efforts, in the greater Phoenix area, which is really great. And I kind of hope to apply all this to emergency medicine as a future career.
And I'll just briefly introduce myself. My name is TARYN PEREZ. I'm also a third-year medical student at the University of Arizona College of Medicine, Phoenix. I'm interested in pursuing a career in addiction medicine because for the last decade, I have worked at VA Palo Alto, examining various aspects of quality of care for veterans living with opioid use disorder and chronic pain. I'm also working with the U of A's College of Public Health to expand harm reduction services and education in the Phoenix area. I have around 15 years of experience doing direct street-based harm reduction outreach to people experiencing homelessness and who also use drugs with various organizations across Arizona and California. All right, so I'm going to go ahead and are we ready to pull up our maximize the screen. Let me know if you guys can see our presentation.
Looks good.
Okay, great. So now it's going to present the first part and then I'll present the second part.
Awesome. Okay, so we're going to start off talking about Street Medicine Phoenix, and we'll give us some special shout outs to our harm reduction efforts because that is the group that TARYN and I were involved in, like we said in our introductions. Advance. Okay, to start off, we just want to say that we have no disclaimers or disclosures to discuss. This presentation is like entirely our own, does not reflect the perspectives of our school or employers. Therefore, okay, so Street Medicine Phoenix more broadly. So while we're kind of branded with, the Arizona University of Arizona College of Public Health, it is a very multifactorial organization that we're a part of. So we can see some of the other groups on the right. That will include Mayo and Creighton. Those are big contributors to Street Medicine Phoenix, and they're really important, providing a lot of, physician preceptors and medical students for volunteering. Midwestern is another great school in the area that has provided a lot of like support to us, especially with students for one and veterinary students, which is really unique and really awesome. Then ASU also has some like contributions, which is really great. Kind of more about what we do. It's not just kind of like medical aspect to our work. It's very broad and multifactorial, very interdisciplinary. And that kind of brings us to our bottom point at the bottom, where it says we're kind of trying to practice the biopsychosocial model of healthcare. And that just means we're, encompassing a lot to our work, not just medical. There's like a lot of factors going on, whether it's like policy based or housing based or maybe like food nutrition based. That's like not necessarily medical, but everything is really contributing more broadly to what's going on with their patients. And we're just trying to, make strides there to better help our patients. So if we can kind of sum up what we do in one slide, this would be it. Really what we're trying to do is just have boots on the ground with our volunteers and our preceptors, meet our patients where they're at, which is on the streets or in shelters, and provide care to them directly because unfortunately they're not always able to get care, in clinics go themselves to, medical facilities. So it's important for us to meet them where they're at and treat them there and do whatever we can to help them out. Why this is important. So, if we kind of take a step back, healthcare has its downfalls in the United States for like a lot of different reasons, and that's kind of just exacerbated for vulnerable populations. And people experiencing homelessness is absolutely one of those populations, right? And that's for a lot of the reasons that we have stated here. So if we're talking about like, just like chronic diseases, so if it's heart disease or lung disease, that's just not going to be taken care of as well in a person experiencing homelessness because they're having trouble getting to the clinic. Maybe that clinic is far away, they can't walk there, or they, had their bus fare, but it got stolen, or they needed to use it for something else, food or shelter or something like that. They weren't able to get to that appointment. So those chronic diseases kind of just like pile up and get that much worse, right? In addition to that, malnutrition can really exacerbate like different chronic conditions and different pathologies, whatever it may be, just because they're not, getting that proper nutrition, right? And, the resources aren't always like that, perfect on the street and in these shelters. So that unfortunately goes to the wayside a little bit. Substance use disorder is another big contributing factor. Stigma contributes to like the kind of delayed treatment for substance use disorder. And then, unfortunately, like fear of like legal retribution can also be a contributing factor to getting help for substance use disorder. So that will again contribute to these like broader health impacts that are just like, causing people to not necessarily seek care or be afraid to seek care, right? Violence is, the next thing on our list. That's a big thing on the street. Unfortunately, it's not just from, other people experiencing homelessness, like whether it's friends or neighbors or something like that. Sometimes there is violence from more institutional perspectives, and that's another important thing for us to try to help out and make sure, it does not happen. Infectious disease is huge, unfortunately. A lot of communicable diseases do not just occur, with homeless people. It's just like any people who are packed into tight spaces, whether that's like military recruits in a barrack or, kids in a summer camp. When people are together, it's just going to cause diseases to spread like wildfire. And, when people are in a shelter, that's going to be happening here. So that's like a really big thing that we were trying to like, take steps to avoid and make sure people are not getting to worse steps through infectious disease. And then mental illness is another big thing. Mental illness treatment is not entirely up to where we would want it to be, but hopefully, we can make those strides there in the coming years and decades and make sure that that is better for our homeless population. And all this kind of like encapsulates this point on the bottom, that all these things kind of like interconnect and interweave to cause people who are experiencing homelessness to have about a 12-year shorter lifespan compared to the general population. And that's really what we're trying to like, hit head on with Street Medicine Phoenix and make sure that that does not continue to grow and maybe gets, even more narrow to our general population, right? So we kind of talked more broadly about what Street Medicine Phoenix does and why it's important and why our team is needed. But we can kind of like take a little zoom in. We'll see that we have like three main pillars to what we do. So on the left, we have our mobile health outreach. That's kind of what I was talking about before, which is, our students and volunteers and preceptors with their boots on the ground, helping people where they're at and doing what they need to do from a medical perspective to get patient care. In addition to that, we have our little middle pillar, which is kind of more tangential, but again, really, really important. It's kind of focusing more on resource navigation. So we have a lot of great employees who are working with Street Medicine Phoenix, kind of doing more like social work kind of stuff, getting people to housing and getting them food resources and then connecting them to care with, mental health exacerbations or substance use disorder treatment. All those connections to care are really important and stuff that's like that we're really trying to like hit head on so that, the medical aspects don't get too bad, right? If we have those preventative measures, it can make those medical exacerbations a bit diminished, right? And then we have our advocacy and research arm, which is much more behind the scenes for Street Medicine Phoenix. Our medical students are fantastic scientists, and they're always very curious to, solve problems in our world and do what we can do to, help, learn more about our population, especially the homeless population is vulnerable and understudied. So doing that work there is really important. And then on the advocacy arm, unfortunately, this vulnerable population does not really get the attention it really needs. And we're just hoping to, make those strides to make sure that, that care is delivered and do what we can from both policy and, institutional standpoints. Okay, so next I'm going to talk about the medical students. The medical students are quite literally the lifeblood of Street Medicine Phoenix. I mean, I'm biased, I'm a student, and so I am going to, advocate for them 10 times out of 10. But, Street Medicine Phoenix is run by students. We have, again, really great employees who keep the organization afloat, but the students really provide what we need. And so while Street Medicine Phoenix definitely needs the students gain a lot from Street Medicine Phoenix and just the experiences that they have on the street runs. And that's kind of detailed here on the right. So, working with this vulnerable population, it really introduces students to unique health circumstances that you don't always get in a more traditional healthcare setting, whether you're like in the hospital or in the ER. Having these kind of like pre-hospital encounters is really unique, especially with, these just very different, health circumstances. It creates, interesting learning points for students and really helps them learn so that they can help more people in the future and gain that passion for, these kind of populations to keep that work going in their further careers. And again, talking about that specifically is kind of more about the social determinants of health. And so those social determinants of health is like really going to be imprinted upon the students and really help students kind of see those barriers head on and try to like acknowledge them in future patients and really, get that care to where it needs to be. In addition to that, the relationship that students build with preceptors is very, very important. So when students are on these runs, they have a lot of independence for one to kind of like conduct these interviews and interact with their patients one-on-one. But we're always being, overseen by preceptors, doctors who have their medical license and we're practicing under their medical license and they're double checking our work and whatnot to make sure that everything is correct and appropriate for our patients. But building that relationship with those preceptors is really, really important. Preceptors are so busy when we're on our clinical rotation that sometimes it's hard to refine our skills and really ask the questions that we want to and get those thorough explanations. But we have a bit more time on these street runs. And so building those like one-on-one connections and getting that mentorship is really great for students and for preceptors because it's one of the reasons that they love working with us too. As I mentioned before, the independence that students get is really great. We have like really good opportunities to further refine our interview skills with patients and then our more physical exam skills. So that's kind of like working with our hands and, listening to patients' hearts and lungs and doing maybe like musculocutaneous maneuvers to see what we can figure out about a patient's body. And just getting that practice is like really, really, really great and really important for us to like become better prepared for the future, right? Kind of lastly, I think another great aspect of what street medicine offers to students is the leadership aspect to it. So like I said before, TARYN and I were Overdose team leads, but the organization is really held up by like student leadership. And so getting those opportunities to, work on your communication skills and lead teams and, recruit volunteers and recruit preceptors is really great for students and a really unique opportunity for us to just become better physicians going forward. So all this is like really great opportunities for students to be working with Street Medicine Phoenix, but also provides like a lot of incentive for preceptors to be there too. So the student teams, before I kind of jump into like what our specific teams are, just to kind of give an overview of what our volunteer model is, we kind of have these teams, which I'll talk about on the next slide, but we just have this general kind of pool of volunteers who will see patients for whatever general reason they want to be there. And sometimes if they're interviewing a patient, they see something is kind of wrong or a patient is talking about a certain kind of thing, a volunteer may refer out, and I'm using air quotes here as refer out to another team on Street Medicine Phoenix to kind of give them that like specialty care, I guess, and get that problem like more acutely taken care of and have like more niche care. And so that's what we have here. We have these 6 teams. We have some more teams in the next slide to make a total of about 8 teams. But I'll start off talking about them one by one with the wound care team. The wound care team is really awesome. They do a lot of great work. They're truly are, hardcore rock and rollers of Street Medicine Phoenix. They are not afraid of anything. They see some really gnarly wounds and they can do a lot of good for our patients. I think the classic story that we hear a bit frequently, unfortunately, is that a patient will come in and their wound is maybe a bit neglected. It's been there for a couple weeks, and they'll take a look at it with our wound care team and see that there's maybe some organisms growing in there, so maybe bacteria or fungus or whatever, and maybe sometimes insects are growing in wounds, unfortunately. And the wound care team does what they do best, and they just take care of it. They will go in and clean out wounds, properly dress it and stuff, and patients are doing really well after that, which is fantastic. I cannot say enough good things about the wound care team. They're really awesome. They do a lot of really good work. The mental health team is next in our slide. They are really great. In addition to doing kind of more basic things for mental health, such as like pads and tampons, they do a lot of really great stuff more broadly. So if we're talking about like contraception, they will give out, condoms and dental dams and stuff like that, but also emergency contraception, so stuff like Plan B, if you guys have heard of that on like TV or something like that. And I believe there's also a over-the-counter oral contraceptive like daily pill that they can give out, which is also really great. In addition, they will also hand out like prenatal vitamins if a patient is asking about that, just because it's another thing that is, not really met for our population. And so we want to give vitamins when we can, right? The vet team is really awesome. I mean, they bring puppies into the clinic, and who's going to hate that, right? In addition to like how that just boosts morale for all of the volunteers, it's really important. It gives a really tangible importance to our patients because sometimes the one thing that is like preventing a patient from getting into shelter or getting further care is that their pet is not vaccinated. And so if we bring this pet into the clinic and they meet with the vet team, they can get their shots, right then and there. And now that patient is able to get shelter, which they weren't able to get if they didn't have that encounter with Street Medicine Phoenix. So that's like really, really important and a very tangible aspect to the work that the vet team does. In addition, companionship is important on the street, and sometimes a pet is a person's only companion, and keeping that companion, happy and healthy does a lot for a person's, well-being. So we try to get that care where they need it. The HIV team is one of our newer teams. They're really cool. They provide point of care HIV testing to our patients. In addition to that, they'll provide like education and connections to care and just help destigmatize HIV, which is so important. It's a nice, connection to our harm reduction work, which is, again, something that we could talk about forever, but they do really great work. Next is the clothing team, another one of our newer teams. They will take in volunteer or donations of clothes from all around the valley and pass them out on the street. Unfortunately, from time to time, it's not uncommon for us to be out on a run and see a patient, completely without clothes. And so that's what the clothing team is there for. They will provide clothes to people that they wouldn't ordinarily get. And it's like really great for them. Having that kind of coverage is really important in, the cold of Phoenix sometimes. And then like the extreme heat, making sure you're not getting that radiation. So they do a lot of really great work. The harm reduction team, I won't spoil it because we have a bunch of slides later, but it's very near and dear to both my and TARYN's heart because that is the team that we were leading for the past year or so. And I think we do a lot of great work, but TARYN will talk about that in a second. The optometry team. The optometry team is really, really cool. I think they're maybe one of the most impactful teams on our broader Street Medicine Phoenix organization. What they do is they'll do eye exams on patients, and then if they determine that there is, a vision problem, they can literally make a pair of glasses on the spot for a patient and get them glasses, so that is actually like pretty life-changing. I think the classic story that we hear is that maybe a patient was recently released from jail or prison or something like that, and they're trying to get back on their feet, get into a shelter or getting a job specifically. And maybe they like previously were a truck driver, but now they can't pass their vision exam because they don't have glasses. So giving them their glasses will literally allow them to get employment. That employment will give them an income to help get housing and get food and just get back on their feet, So unfortunately that they have to have a run-in with us, but like this team can do so much for a patient. It can literally get them back on their feet, and it's like extremely, extremely important. And they do a lot of really great work. I will hand it off to TARYN here to take care of the rest of the presentation.
Okay, so the reason why we're transitioning right now is because the last portion of this slide is sort of an unofficial team that we have of folks that go out on Fridays to work with one of our community partners, Shot in the Dark, which is a fabulous harm reduction organization in Phoenix. They let us come out with them, and students have the option to go out with one of our the street medicine founder and one of our main preceptors, Dr. Fowler. And that segues really well into our next section. So we're going to talk about the harm reduction team. The work of the harm reduction team has been in collaboration with the MEDCOPH, which is the College of Public Health NOPAL initiative. So NOPAL stands for Naloxone and Overdose Prevention Alliance. So really briefly about NOPAL, it's a grant-funded program through, like I mentioned, the College of Public Health, which collaborates with community outreach programs to provide harm reduction services and education. And we'll get into the different parts of that. But we just wanted to be really clear that this work is supported by the College of Public Health, and we wouldn't be able to do any of the things noted on this slide without them. So the harm reduction team focuses on direct outreach to teach harm reduction techniques, distribute harm reduction supplies, and provide support to people who use drugs. And this is really a multifaceted approach. As you can see here, we have like seven little circles. I can't count. Seven little circles that sort of encompass all the work we do and all the work we're expanding to do. What we started with was solely overdose recognition and response, as well as naloxone distribution. So when Noah and I stepped in as leads, we, as you can imagine, student organizations do have like annual turnover essentially to make sure that every class has a chance to lead student organizations. So when we were leads, when we stepped in, those were the only two things that we offered. And while that is amazing, and I think we've done really impactful work in that area, and the folks who worked on this before us did really impactful work, we felt that we wanted to expand the services we provided in the harm reduction realm. So the next thing that was rolled out was sort of a testing kit distribution. And this includes xylazine test strips and fentanyl test strips. Fentanyl, I'm sure you've all heard of. At this point, it's responsible for the wave of opioid overdose deaths that we are currently experiencing. Very potent opioid. So we do pass out and educate patients on how to use fentanyl test strips and sort of work with the patient to come up with a plan on what they should do if the test strip comes up positive. And this is going to vary by patient. So we worked really closely with patients to make sure they knew what a positive test meant and that they had actions that they could take to mitigate harm to themselves. As I mentioned, we also distributed xylazine test strips. Xylazine is more of an emerging adulterant to the drug supply. It is a veterinary tranquilizer. It's also known as tranq, has a lot of different street names, and it's popped up all over the country, mostly on the East Coast. We haven't seen as much xylazine in Arizona specifically. It has cropped up in California some, and it has led to some pretty intense skin wounds, and folks traditionally present with those if their supply has xylazine in it. So we do educate patients on that. Most folks are not as interested in those test strips because they haven't, found that their friends or people that they use with are sort of experiencing the effects of xylazine, but we do offer those as well. We have been building out our connection to care, which has been challenging, but we do work with our community partners. And as Noah mentioned, we work with amazing folks who are employees of the College of Public Health who go out with us and also help us build out those connections to care and provide referrals to people who are interested in substance use treatment. The last three circles on here, safer smoking kits, safer sex kits, and safer injection kits, those are sort of in the works. We have already rolled out safer sex kits, and we've sort of made sure we trained up ourselves on, how to educate folks on safer sex kits. We also work with our menstrual health team to do that. And safer smoking and safer injection kits are currently in the works. And these kits are all assembled by our different community partners, but also medical students. And that kind of leads into our next slide, which is augmenting our direct services by providing peer-to-peer training for future medical professionals. We aim to reduce stigma towards people who use drugs among future healthcare professionals. And that was like a really important thing to our team. And part of the goal of having medical students actually have their hands on harm reduction kits was to familiarize themselves and learn like, what do these things actually do? Like, how can we incorporate this into future efforts with our patients? Oops, hold on. Wasn't ready to move on. So some other examples of trainings and educational efforts, we implemented an annual opioid overdose recognition and response training for MD students. It wasn't previously part of our curriculum to learn how to recognize and respond to an opioid overdose. So that is happening annually for every first-year medical student class that comes in. We also have one-on-one train the trainer opioid overdose recognition and response. So we train students who go out with us how to train people on opioid overdose recognition and response. So they can go out and help us educate patients as well as other healthcare professionals. And we also hosted cross-campus talks on addiction medicine and harm reduction, which encompass the organizations we touched on our second slide. Okay, so I just wanted to include some data. This just covers like the last year, like January 2025 to January 2026. So in that span of time, we distributed 815 naloxone kits. We distributed 268 fentanyl and xylazine test strips since August of last year. And we also had our patients reported to us that our naloxone specifically was used to reverse opioid overdoses. That was 117, which, that's huge. And we couldn't do that without the folks who are living out there on the street and protecting their own friends and neighbors. This is just like a brief demographic slide. Some of the demographics related data we've collected in regards to naloxone distribution. So the age distribution is pretty wide. We didn't have anyone who was underage receive naloxone. The ethnic and racial demographics of our patients is also pretty widely distributed, and 8% of the folks that we distributed naloxone to self-identified as being veteran. Okay, before we get to questions really quick, I wanted to highlight this last slide. These are the folks that we do this work in conjunction with. And if you do want to make future connections with Street Med Phoenix, like if you, for example, are a medical provider and you would be interested in coming out with us as a preceptor, we would love to have you. And these would be the folks you would reach out to, particularly Dr. Bauer on the right here, whom without Street Med Phoenix would not exist. Like he started this program and pours an immense amount of his own time and energy into supporting all of this work. And our coordinator, Regina, is also amazing. I would reach out to her as well if you're interested in volunteering with us. And Rodrigo and Dr. Soto on the bottom here, they are the public health folks who support this work. And without them, we also could not be doing this. So yeah, I think I'm going to stop sharing my slides and we will take questions.
Yeah, we had a few questions come in. The first is about your HIV team and whether or not they conduct STI testing or Hep C testing and linkage to treatment.
I believe, so they only do HIV currently. I believe their next priority testing to expand was HIV or a Hep C testing. I'm not sure what the status of that is right now. Whoever asked that question, feel free to email. Actually, we should put our own emails. We'll put our own emails in the chat and you can email us and we can get a more definitive answer. But I don't believe any other STIs are being tested for specifically at this point. It is very challenging. They basically have to go out with a mobile van because the tests need to be kept at a certain temperature. And we wanted to provide an element of having privacy so that the patients who do want to get testing go into the mobile van. So that in and of itself took a lot of logistical finagling to figure out. But yeah, I'll put our emails in the chat.
And it's likely the same individual, but they followed up. There's a coalition called the Hep Free AZ Coalition, and they just recommended that maybe you reach out to them. They're with AZDHS.
Awesome. Thank you.
Yeah. And then the next question is related to the data on overdose reversals. How do you collect that data?
It's an imperfect measure. Okay, so this is something, like I said, I've worked in with 5 different harm reduction agencies and no one has quite figured out how to, there is the bias of self-reporting. That's what we're relying on. We're relying on folks to tell us, and we specifically ask, if someone does take naloxone from us, we ask them at the end of the encounter, hey, have you received naloxone from us before? And if they do say yes to that question, we'll specifically ask, have you used our naloxone specifically to reverse an opioid overdose? And if they are not sure, we err towards not reporting it. So this is probably an underreporting number. But that's the best we've come up with. If anybody has any better measures or has come up with something that is, because we also want to respect patient privacy. Part of the challenge of harm reduction data collection is not harming your rapport and relationship with the folks who are coming to you for harm reduction.
Thank you. The next question is related to the services offered. Just a little surprising not to see dental services on there. Are there any plans underway to incorporate this just because we know it's all connected?
That's a great question. As far as I know, dental services are not included as of now or intended to be included. If the person who asked that question is in the dental field and is interested in collaborating, I highly recommend you reach out to one of our preceptors. So that would be Dr. Power or Regina Piggy, which was on that last slide, and we can pull that up again for that contact information. But I think that collaboration would be very, very, very important for our population.
Thank you. And then we have some public health students, not necessarily MD students, logged on. There looked like there was several groups that you did not have to be an MD student to be part of. Is that correct?
That's correct.
Okay, perfect. And then that looks like the last question. I'll double check here real fast. Yeah, we haven't seen any more come in, but I appreciate you guys putting your emails in there. The attendees will have access to that and we'll include them with the recording as well. So thank you both for your time. I really appreciate it. And there was a link to a survey dropped in the chat. So if any attendees wouldn't mind filling that out really fast, that would be great. Thank you so much. Have a great day.
Thank you for hosting us.
Thank you.